Graves' disease, its history and present understanding. What is Graves' disease? Graves' disease is an autoimmune disease that is categorized by goiter and caused by hyperthyroidism. It was discovered around 150 years ago by an Irish physician by the name of Robert Graves. He was one of the first physicians to fully describe exophthalmic goiter, or what we know as Graves' disease today. How was it first understood? The acknowledgement of the enlarged thyroid gland, or goiter, has been around for centuries. One of the earliest recorded accounts made in Greek medicine was made by Hippocrates and Plato. They both viewed the glands as spongy in constitution and were responsible for lubricating the respiratory passageways. However, Galen argued that their spongy nature were better suited for the purpose of absorption rather than secretion. He labeled the thyroid gland an organ of connection and buffer between the heart and brain. He used his knowledge of the four humors to conclude that heat from the body traveled through the vascular networks and converted it to nerve impulses which affected the thyroid gland. How has our understanding changed? Although technology has helped gain a better understanding on Graves' disease and hyperthyroidism, the exact cause of hyperthyroidism remains inconclusive as we still have much to learn from this disease. What we do know is you can be genetically predisposed to Graves' disease or can be susceptible to developing it by environmental factors such as having high levels of physical or emotional stress, smoking, or even pregnancy. Hyperthyroidism occurs when the immune system begins to attack the thyroid gland, thus overproducing two hormones, T3 and T4. Because thyroid hormones are essential to how our bodies use energy, several organs, such as the heart and liver, may become affected when there is an imbalance in the butterfly-shaped gland. How has Graves been defined over time? Our understanding of hyperthyroidism and Graves' disease has been slow in progression. Some examples of this are, in 1802, the symptoms of bulging eyes, palpitations, and goiter were being associated with each other. The discovery of iodine in seaweed led to the discovery of the necessity of iodine for thyroid function in 1907. The term hyperthyroidism was not introduced until 1910. What symptoms pertain to Graves' disease? Some symptoms may include an enlarged thyroid or goiter, bulging eyes, eye disease such as astigmatism, sweating, moist skin, palpitations, skin lesions, weight loss, agitation, irritability, or anxiety, trembling of hands or fingers, change in menstrual cycle, loss of libido or erectile dysfunction, and frequent bowel movements or diarrhea. This can also cause insomnia for some people diagnosed with Graves' disease. Graves' disease and treatment. Seaweed, along with other marine life such as mollusks and sponges, were used as the main source of treatment for a long time. However, today we rely on three forms of treatment. One being medication. The medication given to those with Graves' disease can be beta blockers, which are used to treat heart disease, high blood pressure, and to alleviate heart palpitations and muscle tremors. The second type of medication used is an antithyroid drug. These are used to interfere with the thyroid hormone production until it drops to normal levels. The second form of treatment is a radioactive iodine. The radioactive therapy is used to destroy the thyroid gland or thyroid cells that take up iodine. The third and the least common form of treatment is a thyroidectomy. This is the complete removal of the thyroid. The removal of this will result in a daily treatment to replace the natural function of the thyroid. Society's views on Graves' disease. When Graves' disease was still a very unknown concept, it was perceived as a terrible disease. People believed patients that displayed these symptoms were not fit to work. People with these symptoms lived more restricted lives. Now, Graves' disease is the most common form of hyperthyroidism. 1 in 200 people live with hyperthyroidism, and only 50% of those people have been diagnosed. Several articles of personal experiences of those dealing with Graves' disease speak on their glorification they receive when they explain their symptoms with hyperthyroidism. People tend to joke on how their metabolism helps them stay thin. This creates a culture of insecurities for women dealing with an unhealthy weight. This then becomes problematic because the severity of the disease becomes minimized in the public eye. Although our understanding of Graves' disease has made giant strides since its symptoms were first acknowledged, there is still so little the medical community truly understands.